Welcome to our show, produced by the Charles H. Wright Museum of African American History. We have the great privilege and honor of having two of Detroit's own most esteemed psychiatrists. We have Dr. Michele Reid, MD, and we have Dr. Curtis Oliver Longs. Curtis Oliver Longs, MD, as our special guest. Both are Detroiters. In fact, Dr. Reid attended Detroit Public Schools and received her undergraduate and medical education at Fisk University and Meharry Medical College in Nashville, Tennessee. After completing her psychiatric residency at Wayne State University in Detroit, Michigan, she served as medical director at Northeast Guidance Center, and then as medical director at the Detroit Wayne County Community Mental Health Agency. Currently, she is the chief medical officer at CNS Healthcare, a 24 million plus outpatient mental health provider, serving over 7,500 children, adolescents, adults, and older adults with mental disorders, including substance use disorders. And she, Dr. Reid, is a clinical assistant professor at Wayne State University, Department of Psychiatry and Behavioral Neurosciences. Dr. Reid is also the vice president of the board of directors at Northeast Integrated Health and trustee at large for the American Psychiatric Association. Welcome to our show, Dr. Reid.
Thank you.
And you're welcome. And Dr. Curtis Oliver Longs. Curtis Oliver Longs, MD, provides treatment of behavioral and psychiatric disorders in adults, adolescents, and he has a private practice at Behavioral Health Initiatives, LLC. He is the mental health director and psychiatrist at the Wayne County Juvenile Detention Facility in Detroit and provides psychiatric treatment for adult, adolescents, and children at the Northeast Guidance Center, CMH agency in Detroit. In addition, Dr. Longs provides medication management as well as psychopharmacological education for children, teens, adults, and geriatric patients. He also serves as an adjunct professor, as a preceptor for psychiatry residents from Michigan State University and Wayne County Mental Health Authority. Welcome to our show, Dr. Longs.
Thank you, Dr. Brown. Good seeing you again.
Good seeing you again, sir. And we're going to start with Dr. Reid. Dr. Reid, CNS Healthcare, can you tell us something about CNS Healthcare?
Oh yeah, CNS Healthcare, we're a certified community behavioral health clinic, and we provide outpatient services, like you said, to children, adolescents, adults, and older adults, specializing in psychiatry and substance use disorders. And we're also a certified community behavioral health clinic, so we have funding from the federal government that allows us to see people on a sliding scale, and we focus a lot on individuals who are uninsured, people who are underserved, or even underinsured, and particularly with a focus on serving Native Americans, the LGBTQ community, and also veterans. That's an important part of what we do. And we also offer medication-assisted treatment for opioid use disorders.
Yes, ma'am. And Dr. Longs, can you tell the community about your practice?
Well, I have a private practice, which is rare nowadays, unfortunately for psychiatrists, for a lot of different reasons. I think that both yourself and Dr. Reid can understand in terms of reimbursement, of course. But you know, I always tell individuals I keep a private practice really for my own sanity, such that all the things that I learned how to do my training through Wayne State and Lafayette Clinic, I'm able to still do that in a setting in Southfield. Primarily, I see individuals on Sunday, which you find kind of rare, but if I'm centered on the family, Sunday is a great day where both mother and father can come in for an appointment. Besides that, I have a nonprofit, LLSM, Behavioral Initiative, and that's our nonprofit that initially was aimed at looking at violence within the Detroit, well, the police departments, in Detroit Police Department particularly, as well as we wanted to offer services for individuals that we know as very creative, and some who may have mental illness, but it was offering assistance for them as well.
Yes, sir. Yes, sir. So both Doctors Reid and Longs are doing great work in the community in their hometowns. Dr. Reid, can you tell us about the coronavirus pandemic? What have you noticed at CNS in terms of the kinds of patients that are now presenting to your doors in terms of first-time patients or things like that?
Oh, I would say for sure in the coronavirus pandemic, we are seeing more and more people. A lot of it has to do with people seeking treatment for grief and loss. So they've lost loved ones, others because they've lost jobs themselves, or others even with the aftermath of the coronavirus, that they have become disabled and unable to work. We work with some people who have developed chronic liver failure and kidney failure, and also a new onset of chronic heart disease that has not enabled them to work. But the silver lining, if there isn't any such thing for this COVID-19 pandemic, is a way that the Medicare and Medicaid, the payers, and the state of Michigan, the Michigan Department of Health and Human Services, has worked with the behavioral health providers in expanding access to telehealth. So they have removed every barrier there was to getting telehealth. So many of the new people we are seeing them. Not only can we see them with audio and visual through a cell phone or through a computer, but we're able to do telephone only services. And in the past, the individuals had to be in our building. You know, the prescribers or the doctors could be elsewhere, but they had to get to our building. And we found with our needs assessment with the Certified Community Behavioral Health Clinic, one of the number one reasons that people are not seeking treatment is the fact that they don't have transportation. So now we've removed the transportation barrier, and there have been a couple bills passed in Lansing that will be effective in October. So we're really hoping our state of disaster and emergency are on until August 13th. That'll give us another month for the expanded telehealth, and we're looking forward to these bills being implemented in October that would allow us to continue to provide services through telephone and telehealth. So even if people don't have a cell phone, you know, we can just do it through your landline phone. So that has been a big thing, and people are extremely appreciative of the ability. I don't have to leave my house. I don't even need to get dressed, and they can get help. So that's a game changer for us.
Yes, ma'am. So there has been a lessening of barriers to health care.
Absolutely.
Yes, ma'am. And Dr. Longs, in your practice, what have you noticed in terms of your professional population, maybe the executives or those with high stress jobs that might not have sought care? Have you noticed an increase in this population seeking your services?
You know, that's a interesting question, and I'm going to make some comments based on my work within the Wayne County Juvenile Detention Facility, which is the largest detention facility in the state of Michigan, serving the county of Wayne. Now, this facility services kids technically from ages 12 to 19. But since I've been there, I'll be honest, I've seen a 9-year-old there, and I've actually seen a 21-year-old. Mm-hmm. And it's interesting how this virus is affecting youth. And in terms of Wayne County or throughout the country, some of the crimes these kids are committing, from the newsreel, you know, you may assume that, well, this person robbed some person because, it's just a juvenile delinquent. But when these kids come in that facility and they're wow, and one thing that the COVID virus has done, I think for my advantage, is that the courts are closed. A lot of the residential facilities aren't accepting kids based on the virus. So they're downtown for an extended amount of time. And that gives me an opportunity to really engage them. And piggybacking on what Dr. Reid had mentioned regarding CNS care, although Wayne County Juvenile Detention Facility does not have telemedicine yet, the fact that CNS care is in Wayne County now is ideal, because a lot of times when these kids leave juvenile facility, and let's say they don't go to a residential facility for 6 months, but they go home on probation, truthfully, not a lot of the community mental health agencies really welcome these kids with open arms, and in some cases for good reason. So for a facility such as CNS care to be operable and the use of telemedicine, that is gonna, I think, gonna decrease the recidivism, because you can have instant contact with these families, not only the kids, not only the parents, but also the probation officers and the other caseworkers. But downtown now, our census is low, but we have a fair amount of very severe cases when these kids with capital crimes, unfortunately. And like I was saying, with the impact of this virus having these kids there so long, I'm used to whatever they're going to tell me, superficially. But if they're there almost 8 months and they know they're going somewhere else, that's somewhat it's more of an open door for these kids to engage. And if I'm seeing them on at least a weekly basis, and in some cases twice weekly, I think that really is going to serve the community, as long as we have an extension, and hopefully CNS will be that agency where we can plug in. Because the recidivism level in Wayne County really shouldn't be that high. And I worked for an agency that was supposed to serve as adolescent kids on probation. And I'll be honest with you, I don't think it was an open arms sort of presentation for them, such that the attendance record was even lower than you would have thought with kids who have a court-ordered level of treatment.
Well, we'll invite you out, Dr. Long, so you can see the facilities and meet the staff, and we're very welcome. But Dr.
Looking
Brown,
forward to it.
You asked a question about how this virus had impacted people. You said, the titans of industry and others. I mean, I can tell you in my own family, my sister's a radiologist. She works in Maryland, and there are about 80 radiologists in the group. She happens to work in a breast center, primarily outpatient work, and all of them, no work for 8 weeks. My sister is a radiologist, graduated from Michigan State University Medical School, and she was on unemployment for about 8 weeks. Thank goodness things have picked back up and she found a new job, but it is affecting all sorts. I have friends at Beaumont, U of M, PhD psychologists who have been working for 15, 20 years at the facility, hours cut back. Another friend, head of a department at one of the large hospitals here, worked there for 35 years and just walked out of the building because the reimbursements are going down. So it's affecting all sorts of people that these are not traditional people who you would expect will be vulnerable in an economic downturn. It has affected everybody.
Yes, ma'am. Does this population have the coping skills? They're high achievers. Do they have the coping skills, or how do you advise them at this point in their lives?
Well, I can tell you, we developed these tips for mental wellness. And I say I developed them with one of my colleagues because I went through it myself. The first 3 weeks, we were working 7 days a week to figure out what to do, get everybody safe. And it was just nonstop. And then I was, watching the news all day, every day, trying to keep up. And it was just too much. After 3 weeks, that was it for me. And I realized that the only way I was going to get through this, first of all, limit that screen time news intake. 30 minutes a day, that's it. I can't, no more than that. Also, what I realized is, for me, it worked for me and people I've been advising, sticking to a routine. Your sleep, your eat, your exercise. I was a gym rat. I go to the gym 5 o'clock every morning. The gym has been closed, so I now walk at a couple of different local high schools or in the neighborhood. and really just force yourself every day to think about positive things that are going around. I went to walk in a park, and it was just beautiful on Sunday morning. And, thinking about that, seeing the deer out there really made me feel great. And, just setting and achieving small goals. For the first couple of months, I used to go to the gym 5 days a week. I was doing nothing. And a friend of mine said, well, why don't you just start off doing something small? So I started, when I would go to work, I would just walk around the block of the building. It was a mile, and that was good. And also, the other thing I'm saying, like, keep in touch with families and friends. Like, even though you can't be with them, like my cousins from all over the country, we have a Zoom teeny party every once a month on Friday from California, New York, DC. We all get together in Detroit. And the other thing is, this whole disaster planning, it made me really rethink, what is a disaster plan? What do I need? What will be there? I mean, who would ever thought it would bring me joy to find some Bounty single sheet paper towel, my very favorite paper towel. And that was like, that made my day. I cannot stand those selector-sized paper towels. And I think the other thing is, you gotta be kind with yourself. Sometimes you're gonna feel overwhelmed with it, and you just have to shut it down, turn that phone off, and just chill back and relax a little bit. And of course, reach out if you need help. That's what I found worked for me. And we've been sharing that with people, 8 tips for mental wellness during the pandemic. And it seems that it quite, but that schedule, keeping your schedule is, I still get up in the morning as if I was going to the gym. So whenever they open, I will be there.
Yes, ma'am. That's great advice. Great advice. Dr. Longs and Dr. Reid, what do you all think? And I'll begin with Dr. Longs about the masks. Why have the wearing of masks elicited such a primal response across the country?
Being in an environment with youth, from ages 13 to 19, they present just with their innate resistance to everything, go left, go right, anything in terms of going to bed in this facility. So one thing that I've noticed is with these youth, and I would say these youth are at a critical point because, some of them have mental illness, some of them have behavioral issues, but the bottom line is they're isolated in a detention facility. So when you're able to engage their parents and get some information regarding why this kid is in here, that resistance will start in the family. So when you see these stories, let's say the story in Flint where an adult, and I hate to say that in psychiatry, we just assume people may have some behavioral / mental health issues or just stress issues. But I think a lot of times when you're confined by something you can't see, like this virus, and you have to do all these routines and things that restrict you, you get a little bit stressed, and you'll start saying no to things that really you shouldn't say no to. It just makes common sense, even though the average person doesn't understand the spread, but to cover your face, that just makes common sense. However, if you have the leader of the free world confusing everyone and refusing to wear a mask and telling us that, this thing is going to go away like, it's just like making lemonade. You finish the lemonade and it's gone. That creates even more stress. But to see it in the media lead to deaths and things like that, it really is unfortunate. But I just think people in general, people don't like to be told what to do. And again, seeing these kids, you see it, and you see adults patterning what you see with these youth.
Right, and I think also that the people are looking to individuals like us. They're looking to their psychiatrist, to their primary care provider to talk to them. I tell them, hey, if you don't hear from Dr. Adams or Dr. Fauci on the TV, don't believe it. My own relatives will call and ask me, I say, did Dr. Adams say it? Did Dr. Fauci say it? If they didn't say it, just don't believe it. So I think they're really looking for us to step up and take a leadership role and to lead by example. The governor in Michigan is very clear. We must be wearing masks anytime when we're out in public or unless not able to social distance. And I think it's just looking for people like us to take up and leadership. And you just learned so much. We just did some videos for work. How do you put on a cloth mask? How do you appropriately put on a face mask? I had Dr. Jerome Adams on the video that we're showing and Dr. Fauci. And I mean, just things, even with washing your hands, like I looked at my own infection control policy and the policy said, wash your hands for 15 seconds. So we had to revamp our own policy. And I said, oh, well, I wasn't getting my wrist the way I should have been. So even myself, being in medicine for 40 years, I learned a lot about it. And I think it's really just one by one, sharing with families and friends and letting those of people like us in leadership positions in the community lead us out of this morass that we're in now into better health. And we've gotten some exciting news in the last couple of days about the vaccines. And I think as physicians, we have a role to play in terms of educating the public about vaccines and addressing vaccine hesitation in our community. Because even as the good news comes for the vaccine, we need to be prepared now for people to understand that just like, the other measles and mumps and other diseases we hardly hear about, as a result of these vaccines, that this is going to be part of the key. So, the testing, the tracing, the treatment, the vaccine, all of this is going to be absolutely key to get control of this COVID pandemic and get us going in the right direction.
Yes, ma'am. Speaking of vaccines, Doctors Reid and Longs, what strategies would you offer what advice would you offer to myself and other primary care physicians as we are on the front lines when the vaccine does become available, trying to convince doubting community that this is the thing to do?
Well, I say, first of all, let's deal with flu and pneumonia, because these things are coming up even before the vaccine. So September, for all of us to partner together to have robust vaccine programs. I can't tell you, I've done several thousand vaccines over the last few years. I cannot tell you how many primary care physicians are not offering vaccines. Even my own doctor, when I was looking for a shingles vaccine, not offering it. So really, they're pushing people out into the retail pharmacies. There are issues with insurance coverage. So really, we've got to partner together in the medical community to make sure there are no gaps. So even if the current system, for making sure the shingles, making sure the pneumonia and the flu vaccine gets out to everybody, and then educate. More programs like this, we could do a program on it in the fall. But I think once you get people talking about it and getting those vaccines done, you've got to have 70-80% of people vaccinated for it to work, and we cannot slack on that. So I think really talking to people about their health, about their relatives, their elderly relatives, their children who are immunocompromised is just key. And there have been quite a few resources. I've been to a few webinars with the CDC on vaccine hesitation. So they have some really good resources for physicians around how to talk to people about, vaccine hesitation. It's a big thing.
Well, thank you, Dr. Reid.
One thing I will add is, as Dr. Reid was talking, and Dr. Brown, when you presented the question, and I will admit, I hear a lot of conspiracy theories, just in general. I mean, you hear it regarding whether the virus is real, if it's a hoax. Then when you started talking about African Americans, of course, when you're saying, well, I want you to take this vaccine, or I want you to take this pill. And in psychiatry, believe me, it's an ongoing part of what we do in terms of patient education. But at the same time, you can't help but listen to all the historical, a lot of times truisms in terms of like the Tuskegee experiment, things like that. But I think for a physician I think for a physician as yourself, Dr. James Brown, in terms of knowing a sense of history with us is vital. Even as I'm engaging these youth downtown, and I'll tell my colleagues, you know what? This kid doesn't need Prozac. This kid doesn't need Seroquel. What this kid needs, unfortunately, he's never gotten is a sense of self and history. So, I just lay it on the table with him. So I think that's got to be the same approach with us in dealing with medicine. Yeah, there's a lot of reasons why not to trust medicine, even this white coat I'm wearing. But the facts are what they are. Creating a person's awareness and sense of the founders of medicine, the historical significance of medicine, I think will go a long way.
Right, and I think also the partnership between healthcare organizations, between private primary care physicians, the AARP, the Wright Museum. These are very key stakeholder partnerships because you got to get out in the community and do the outreach. So there's just
Right.
nothing
I agree.
Yes, ma'am.
Yep.
Yes, sir. In terms of along the lines of mask wearing and social distancing, you know, I look around at the news, the cable channels, and so is everybody. The weather got a little warmer. They're crowding the beaches. The governor of Florida opened things up very quickly. Georgia was leading the way in terms of opening up very quickly. What, in terms of from you all's professional opinions as board certified psychiatrists, what is driving this behavior by elected officials to ignore reality and to ignore the data and to ignore the safety, the protocols that must be in place for the safety of their constituents and the citizens of their states?
I think it boils down to one thing: leadership or the lack thereof. I mean, you can't say anything. It has to. I mean, this is the tradition of public health coming out 100 years ago of, you know, the 1990 flu pandemic. Our entire public health system was built up to deal with this, and over time, with various budgets and funding cuts, have just made dramatic changes in the ability to get the job done as far as public health. But I'm ever hopeful about Dr. Jerome Adams and Dr. Fauci getting the message out there, getting the vaccine done, and people like us in the community on the ground dealing with these vaccine hesitations one by one, and educating our families, our friends, and the patients that we treat about the importance of it. I think it's just, you know, organizations like the National Medical Association, the Detroit Medical Society, the Wolverine Medical Society, it's Michigan State Medical Society. It's really up to us as physicians to be leaders and step in the gap where leadership has failed the people.
Yes, ma'am. Dr. Longs?
Yeah, I agree. For sure, it starts at the top. Yeah, I'm trying to think of a phrase to try to understand it. You know, it's this entitlement, but it's twisted entitlement, such that, you know, individuals on different spectrums of the political aisle know what the truth is, but based on them being somewhat handicapped or handcuffed by the leaders in their party, and unfortunately, it creates this snowball effect in terms of the community. And again, people don't know what to believe. But luckily, we have a governor here and the Surgeon General of the state who is staying steadfast and focused on the reality. I mean, they're staying on the reality, and that's fantastic. But I agree with Dr. Reid. It's going to take a grassroots approach for sure.
Yes, Dr. Jonet Caldoun and Dr. Gretchen Ms. Governor Gretchen Whitmer, or some call her in the community.
Yes, Gilchrist
Big
as well.
Gretch.
And Gilchrist,
don't mess with Big Gretch.
CNN, MSNBC, they've made us proud.
That's right.
That's right. For sure.
In terms of the where do we go from here in terms of the numbers are, you know, we were talking about flattening the curve and with all of the aberrant behavior in terms of what we're supposed to do, social distance and distancing and mask wearing. Not enough of the community or the larger community are adhering to these principles. Where do we go from here from a psychological point of view, mental health point of view, in terms of recalibrating our force of will for those of us that know? Where do we go from here? How do we garner, or how do we inspire people in terms of help to give them hope or a sense of everything is going to be all right? Can you all offer some thoughts in this area?
You know, I'd start with focusing on just, you know, how we are as individuals. We all deal with certain defense mechanism, and denial is a powerful one. But, you know, denial means it's not true. So you focus on chipping away at that. And how you do that is you use facts. You know, you use historical facts. And like Dr. Reid had mentioned, it is going to take a group effort. And I don't think all of us have the answer, but it's going to take a collective in terms of answers. So like he had mentioned, connecting with Charles Wright Museum, primary care physicians, and all the other entities around the city of Detroit and throughout the state and the country, to give that to instill that sense of hope again. And I'd say just in general for Black folks, I mean, we have this inner sense of resilience that we need to really tap into. And that's probably one of the major highlights of working with kids, because, I mean, they have a sort of a dim light, and to really have that light just flash brightly with facts and truth, I mean, it's an incredible feeling in terms of what you receive back from that.
No, and I think we see a lot of loneliness out here, a lot of isolation. People aren't able to get together with their families. So I think that has a big impact. And I'm saying, you know, if you need help, to reach out. And there are a lot of free resources out there. Like they have the crisis text line. They have paid volunteers who are there getting it. And you just text the word START to 741-741, and you can get free crisis counseling. We've got the National Suicide Prevention Hotline at 1-800-273-8255. That's 1-800-273-8255. And we've been looking at a lot of really neat phone apps. One is called Breathe to Relax, and another one is called Mind Shift, and also another one called Self-Help for Anxiety Management. So we've been seeing a lot of apps, another one called Calm, about meditation, a lot of apps coming up. And also too, there's another one that's kind of cute that I use. It's like a little gratefulness journal. So every day you can go in and talk about things that you're grateful for. And somehow, you know, if you're able to focus on that for which you are grateful, then we don't focus so much on the things that we can't do. So I think the pandemic, it really caused us to focus internally. And some people with that internal focus, it's been difficult for them. I say, reach out and get help if you need it.
Yes,
Right.
Yes, sir. Dr. Reid and Dr. Longs, say for instance, you all were running for an office, in terms of, you know, how they have that closing statement in terms of the presidential debates. Speak to the people, speak to their hearts. Let's just say what's on your heart in terms of speak to the people about how we can survive this time.
I would say that if you're out there struggling, you should know that you're not alone, that mental disorders are highly treatable and there's help available. And people with mental disorders do live productive lives and work. And just as if you would look at being a diabetic or hypertension, you wouldn't think of not going to see Dr. Brown for your insulin or manage it. Reach out and ask for help. The resources are out there. CNS Healthcare is out there. And we are here with the community to get through this pandemic and get on the other side of it. And there's hope. There's small things we can do on a daily basis that's going to protect us and our family. I cannot stress how important it is for you to get vaccinated for the flu and for pneumonia if you're over 65 years old, and to wear a mask whenever you're around other individuals and cannot socially distancing, and especially hand washing, something easy we all can do. And that also will help us with the flu to reduce the transmission of flu. So there are many things within our control that we can do, but help is available, hope is out there, and we are going to get on the other side of this and be a more resilient community.
Yes, ma'am. Inspirational words indeed. Dr. Longs?
Yeah, I would agree with everything that Dr. Reid had mentioned. A lot of times I'll engage a person or a family, and I'll just tell them, look, you know, we've all had some form of depression. And so we look at that word, and I try to get their thoughts about what they mean by depression, how they interpret what depression is. And to let them know, look, every individual who's lived has had some level of depression. It may not be major depression, it may not even be minor depression, but we're all adjusting to this unknown factor called coronavirus 19. And of course, not everyone who is depressed requires medication. You know, the power of speech and communication is so strong, and we have to really plug back into that. The resources are out there, as Dr. Reid had mentioned, and we have to do things that you learned when you were a kid, hand washing, those sort of things, and to follow logical sense. And I'm sure, Dr. Brown, you remember Dr. Miss Myers Edwards.
That's right.
Her famous statement was that you have a brain, use it. You know, we all have brains, you know, use practical sense. And even when you're seeing the leader of the free world, our president, become political, as Dr. Reid said, turn the channel. You know, go look at cartoons, or definitely listen to some music. Do something as a distraction. But I mean, the hope is there. We're resilient, and we're going to get through this like everything else.
Thank you, Dr. Longs, and thank you, Dr. Reid.
Thank you, Dr. Brown.
You're welcome.
Thank you, Dr. Brown.
You're welcome.
JB.
We're going to close out now, but before we close, this is your all's platform. Would you like to give any information that you haven't thus far to the community before we close? Beginning with you, Dr. Reid.
Oh, absolutely. Remember, the crisis text line is out there for you. You text the word START, S-T-A-R-T, to 741-741. And for those who are struggling and thinking about suicide, the National Suicide Prevention Hotline is out there. It's 1-800-273-8255. That's 1-800-873-8255.
Well, thank you. And what is the contact number for CNS Healthcare, Dr. Reid?
CNS Healthcare, we can be reached at 248-745-4900, and we'll have some other numbers. We have an 800 number we'll post at the end of the segment. That's 248-745-4900.
Well, thank you, Dr. Reid. And Dr. Longs?
I'm going to give a number to my private practice, Behavioral Health Associates, PLC. That's in Southfield, Michigan. The number is 248-809-6732. We see children, we see adolescents, adults, we see police officers there. We see everyone in the community. In addition, I'm going to give the number to LLSM Behavioral Initiatives, which is the same number, 809-6732. Then a phone, a section of the phone recording will come in, and you can plug into that. That's our nonprofit. We see individuals with no health insurance. Specifically, we're trying to really help the mental health and awareness of a lot of the individuals in our community who are very creative, such that they may be in the entertainment arena, in different facets of that. But those are two agencies that are my passion, and hope people can contact us and we can be of service.
Well, thank you, Dr. Longs. Thank you, Dr. Reid. Again, this is part 3 of our series sponsored and produced by the Charles H. Wright Museum of African American History, COVID-19, African Americans and Racial Health Disparities. This program and the entire programming is the brainchild of Mr. Charles Farrell, Vice President of Community Engagement and Public Programs. This program is called Mental Health Challenges and Solutions, and both Dr. Reid and Dr. Longs were offered the challenge. They gave the solutions. We got what we need to know now. God bless you all.
Thank you.
Thank you, Dr. Brown.
Thank you, Dr. Brown.
Thank you, and God bless you both.